Funding provided by the Georgia Trauma Care Network Commission. So in this video, we're going to talk about the North American Rescue Response Kit. This kit is designed for you to take into your MCI, your active shooter scenario, your trauma scenario, and be able to treat patients with life-threatening injuries. This is a smaller pouch here than your typical ALS bag or your first in bag that you're used to carrying on most calls. The one sling here makes it easier for the first responder to move throughout the scenario to treat patients in a timely and efficient manner. So we'll take a look at the front side of the pouch here. We do have 2 tourniquets for quick, easy access. These are going to be the Gen 7 CAT tourniquets here. With the Gen 7s, you do not have the double buckle like the previous tourniquets. So you do just have the single buckle here for upper and lower extremity application. So our CAT tourniquet is going to be for major hemorrhage on the upper and lower extremities. We're going to put a gloved hand and some direct pressure over the wound. If it continues to bleed, we put a tourniquet on it. Now there's 2 schools of thought on how high to place the tourniquet on the extremity. If you can use the scissors that came in your kit and expose the wound and see exactly where the bleeding is coming from, put it a few inches above the wound and tighten it down. If you're in an obscure environment or you can't see the wound, the school of thought there is to put it high and tight. That way you make sure you're above the wound. So placing the CAT tourniquet on an upper extremity, we're going to put it above the wound, tighten down this strap. You should not be able to get more than 3 fingertips up under the strap when you have this tight enough. We're going to turn the windlass until bleeding is controlled. Usually about 2 to 3 turns and we should have bleeding control. If you want, you can feed this strap back over through here to keep it from coming loose. Pull the timestamp and with a Sharpie mark the time of application of the tourniquet. So same concept when applying the tourniquet to the lower extremities. If you can see the wound, just apply it several inches above the wound. If you can't see it, get the tourniquet as high as you possibly can and tight as you possibly can. Make sure if you can expose the patient's leg, you do so. At the very least, make sure there's nothing in their pockets when you go to apply this. So pull this strap here as tight as you can possibly get it. There again, you don't want more than 3 fingertips to go up under the strap when you get it tight. Tighten the windlass down until the bleeding is controlled. Pull your timestamp off, and if you have a Sharpie, write on it. With larger individuals, if you can't get the bleeding controlled with just 1 tourniquet, you can apply a second tourniquet or use your pressure bandage to go over top of the wound and get bleeding controlled. Moving to the middle here, we have our triage roll. This is designed for your initial contact of your patient to use your salt triage to triage the patient. You can pull the colored tape, tear it. This can go around the patient's ankle or their wrist. Just make sure it's visible to other first responders. While you are treating and triaging patients, you need to think about setting up a casualty collection point. This is going to be a point inside the warm zone where you're gathering patients together. Ultimately, we will move those patients out into a triage mat in the cold zone. It's okay to have multiple casualty collection points. You may have patients scattered across a large area that you find it necessary to have multiple casualty collection points. You also may have patients on different floors, different levels of a building, and you may need to put different casualty collection point on each level of that building. When picking out a casualty collection point, you need to find an area that is safe for your patients to be, and you also need to think about an area that's going to be easy for the patients to enter and exit. In the top pouch here, we do have a small pouch held together with Velcro for spare gloves. This back pocket here is designed for an identification vest. It could say paramedic, EMT, first responder, firefighter, whatever you'd like for it to say. It fits down in there. So on the back of the pouch here, we have the ability to organize Sharpies or glow sticks, and we can go through these as we're clearing rooms. So we can use a red for danger, do not enter. You can mark all over the room, open up the chem stick and spray it all over the door so we know this is a red, do not enter. We can use the blue as this is our room for casualty collection point. And then green can be has been cleared or there's no casualties in that room. The zipper compartment on the back side has hook and loop to put items. We can unzip the main compartment here to get access to more supplies. Everything's secured in elastic bands so it's not going to lose its place. So we'll start here. We have MPAs to help our patient be able to maintain their airway. You have pleural decompression needles. The pleural decompression needle is a 14 gauge and is 3 1/4 inches long. This is going to be used for a tension pneumothorax. second and third intercostal space, mid-clavicular, going over top of the third rib. You're going to bury this into the hub. You have 6-inch pressure bandages. This is going to be used on extremities. And you can also use this along with the compressed gauze for hemorrhage control. Your 6-inch pressure bandages has multiple red pull tabs to open it up. Here, you have a 5x9 to place over the wound, wrap it, and secure it. This 6-inch pressure bandage can be used in conjunction with the compressed gauze for hemorrhage control. So the compressed gauze and the 6-inch pressure bandage work really well in areas that we cannot get a tourniquet in the joints, such as the armpits and the groin. We can apply the compressed gauze and then hold pressure, then wrapping it with the 6-inch pressure bandage to hold the pressure for us. With your compressed gauze and your 6-inch pressure bandage, you can unwrap this, apply it to the wound. Of course, other side is the wound here. And then you can come around and wrap it. As you come around each time, if you will pull and tuck, it will become tighter and become pressed. Once we get to the end of the bandage, has Velcro to stop it from coming unraveling. With a compression bandage, you still should have a distal pulse. If you do not have a distal pulse, you have now applied a tourniquet. Do have a pair of scissors here so you can remove the patient's clothing to find injuries. You have hyphen chest seals. These come in twin packs, so you have an entry and an exit wound that you can cover. These are vented, so once again, with all North American Rescue products, we do have the red pull tabs here, so we can pull and open this up. Does come with a little small 4x4 if you want to clean the blood, clean sweat, whatever you'd like to if you can't get this to stick. But you should be able to get this to stick. Then this is a vented chest seal, so it's going to allow it to vent. Pull the red tab and secure it. As you perform your physical exam and you've found that you have penetrating trauma to the chest and you've applied your chest seal to the front side, remember to log roll your patient and look for penetrating trauma as well on the back side to apply another chest seal. Now that you have triaged your patients and you have provided appropriate life-saving interventions for your patients, it is now time to move them to your casualty collection point.